Why is this surgery different surgery, and what have you done? Can you please explain as I'm zooming on the x-rays?
So this was a case of 2-level degenerative disc disease who was operated before 4 years, and he had a recurrent disc at L4-5, also at L5 as well. If you can focus here, this is the brain, this is the spinal cord. If you come down to L4, L5 and L5S1, the disc is completely degenerated, and he used to have severe back pain. That back pain used to go to the legs. When he came to me, I gave him two options: either to do lumbar disc replacement, which is a spatial surgery where we change the disc, we don't put any screws, and with this surgery, patient can have all the movements. Patient can bend forward, sideways, rotation. He can do running, he can do jumping. Because when he came, he was literally in tears that my life is not good, I am not able to do weights, I am not able to do sports. So with this, he is allowed to do everything.
Excellent. Now my question is that let us say someone already had a disc surgery, not fusion, but disc excision or removal. So can the disc replacement be done in those cases also?
Yes, this is the patient who has already been operated, 2 level of degenerative disc disease. Already he had been operated, but good thing the surgeon has done, he had done a microendoscopic discectomy. They did not destroy or touch the facet joint. That's why I chose to do the disc replacement.
So that means everyone cannot have a disc replacement if a spine surgery has been
very
done.
limited indication.
So that means it matters where the spine surgery was done and what the spine surgery was done. Thank you very much, and God bless you. We wish you a speedy recovery and a life back to normal.
Thank you. Thank you.